You have probably heard the stories where a couple married for a long time die within just a few days of each other. In some cases, the widow or the widower is said to have died of a broken heart. And you're thinking, it's just something from old love songs, right? Believe it or not, the truth is broken heart syndrome is a real thing. With us this afternoon to explain is Dr. Jeffrey Whelan. It's good to see you, sir. Thank you so much.
Thanks for having me back.
Dr. Whelan is the Chief of Division of Cardiology at Peninsula Regional Medical Center. He's an interventional cardiologist. He's the Medical Director of Cardiac Rehabilitation. Basically, Dr. Whelan knows exactly what he's talking about. It's wonderful to have you.
Thanks for having me back again.
So, of course, people grieve the loss of a loved one. Is the broken heart syndrome a real thing?
Actually, it is. What was described originally in a New England Journal article that was published on Valentine's Day many years ago was a syndrome of people suffering for what all intents and purposes looks like a heart attack within a few days or minutes or hours of a major traumatic episode, whether it's an emotional loss or or physical stress like an illness like an asthmatic attack, something like that.
Wow. Are there symptoms?
The tricky part of it is that the symptoms, for all intents and purposes, mimic a heart attack. And the reason for that is what's happening acutely is the same sort of pathology as a heart attack in that there's a reduction of blood flow to the heart muscle. The difference is that in the broken heart syndrome, or Takotsubo's cardiomyopathy as it's called, is that there isn't a blockage to the blood flow with a blood clot, but that the blood flow has been reduced by a spasm of the artery or a sudden global reduction of blood flow.
So then who would you say is most at risk for this?
This is the tricky part about it. The average person who has a heart attack are the smokers, diabetic, males. In broken heart syndrome, typically it is women, and it's women between the ages of 50 and 70, often with very few risk factors. And so that's why many times the person who's suffering these symptoms will think to themselves, or the medical personnel will think, well, this person doesn't have any risk factors, this couldn't possibly be a heart attack. But when you do an EKG, it looks like a heart attack. The symptoms of chest pain, shortness of breath, palpitations, they all mimic the same symptoms of a heart attack, and that's because it's the same pathology, which is a reduction of blood flow, except in this case it's usually short-lived.
Well, now, you said there's no blockage, but there's a spasm.
Yeah, so as you've heard over the years when we've been talking about Heart Month and during Heart Month and heart attacks, when people have these symptoms, we want them to come to the hospital immediately, and they then end up in the cardiac catheterization laboratory immediately with this door-to-balloon time where we're trying to get in there and interrupt the heart attack process. Well, the people who are having broken heart syndrome, they get up to the cardiac catheterization laboratory, we take the pictures, and there's no blockages.
So how do you treat it?
So typically what we use are medications which dilate the arteries and medicines which blunt adrenaline, which we think may be one of the surges that causes the syndrome to be triggered. The good news about it is that generally the heart will recover. Now, so when the person comes into the hospital, the EKG looks abnormal, the enzymes are abnormal, and the pumping function of the heart, which we look at, looks grossly abnormal. The heart sort of balloons. And actually, Takotsubo's is a Japanese name for an octopus trap, which sort of balloons when you get an octopus in it. But if you get into the hospital and get it evaluated and we get you on the right medicine, so often within 48 to 72 hours, we re-image the heart with echo and the heart has normalized. So it's good news is that it's rarely a permanent damage to the heart, but the thing to be aware of is that anytime you have any sort of injury to the heart muscle, there's a risk of rhythm problems and sometimes of what's called heart failure acutely. So if you have these symptoms, you want to get in and get it evaluated and get the acute care within the first 48 hours that will hopefully prevent any of these symptoms going on to something more lethal, like an unstable rhythm, which can happen with any sort of injury to the heart muscle.
Don't brush it off. Don't think you'll get over it. It's going to be okay.
No, and we tell that to everybody. You know, chest pain is something you don't want to mess with. When you get into adulthood. When you get symptoms of chest pain, you need to get it evaluated. And, you know, if you go into the emergency room or to see your family physician and it turns out to be nothing, wonderful.
Great.
Yeah.
That's a good thing.
But if you go in there and you think, well, I don't have any risk factors. Oh, this it turns out to be something like broken heart syndrome. You're at the right place, getting the right care.
Get that taken care of. We're out of time, but tell me real quick, what can we do best to maintain a healthy heart?
So it goes back to our risk factors, sort of know your numbers. And so these are things like blood pressure, high cholesterol, diabetes, smoking, and of course you're dealt a hand from your genetics, that your family history. But you got to hand some of the cards you can improve on and some of them you're stuck with.
Do what you can, stay in touch with your doctor.
Right.
Dr. Jeffrey Whelan, thank you so much for your
Thanks
time
for
this
having
afternoon.
me.
Some very good information.